This is a story of a young woman named Christine. She is a typical 15-year-old high school student and a loving daughter. But her entire life fell apart after knowing the fact that she will become a young mom. It was all an accident, she says, as she acclaims to those people who are judging her that she only slept with one person, and it's her first boyfriend, the father of her child. She and her boyfriend did not know what to do, as at first they kept it a secret to their family relatives. But eventually, the truth came out, and Christine is put in a complicated situation where she asks herself, why did all these things happen to her? We will proceed to the advocacy project, and it is all about teenage pregnancy. According to the World Health Organization, every year, an estimated 21 million girls aged 15 to 19 years old in developing regions become pregnant, and approximately 12 million of them give birth. At least 777,000 births occur to adolescent girls younger than 15 years old in developing countries. However, every part of the world, teenage pregnancies are more likely to occur in marginalized communities, commonly driven by poverty and lack of education and employment opportunities. As a result, according to Carrie Schoolman, if you get pregnant as a teen, you might feel frightened and worried about telling your family and friends. Not talking to someone, not getting the help and the support you need can make you feel more isolated and depressed. For this reason, our advocacy project wants to take steps about this problem in order to prevent the increasing rate of teenage pregnancy cases. Next is the effects of teenage pregnancy. In the effects of teen moms, we have baby blues, depression, postpartum depression. First is the baby blues. This happens when a woman experiences symptoms for 1 to 2 weeks after giving birth. These symptoms include mood swings, anxiety, sadness, overwhelm, difficulty concentrating, trouble eating, and difficulty sleeping. Next is the depression. Being a teen mom is a risk factor for a depression. If a mom has a baby before 37 weeks or experiences complications, depression risks can increase. Lastly, postpartum depression. Postpartum depression involves more severe and significant symptoms than baby blues. Now let's talk about the risk factors for mental health concerns. Teenage mothers are more likely to fall in demographic categories such as having parents with low education levels, a history of child abuse, limited social networks, living in chaotic and unstable home environments, and living in low-income communities. Next is the impact to the child. According to the U.S. Department of Health and Human Services, children born to adolescent parents face greater challenges throughout their lives. These challenges include getting less education and worse behavioral and physical health outcomes. Now we will talk about the preventions. The most effective tips on prevention is that the healthcare professionals, family, and also to ourselves is that we need to encourage ourselves not to engage in sexual activities and be aware enough with the proper use of contraceptives, just like condoms, pills, vaginal ring, and etc. By this, we can lessen or minimize the increasing rate of teenage pregnancy.